Okay, so we're looking at, my name is Chris Webb, and I do a lot of data analysis. Like, whereas Michelle just told you, like, gave you a laundry list of topics, and they're incredibly useful. I'm gonna try to help you actually find them and use them. The presentation that we're giving today is, it's on the web, it's just not available to you right now because of problems, but those issues will get resolved in the next like 30 minutes. Okay, so we just showed you a whole bunch of different types of data, and you can think of those when this is kind of like putting the cart before the horse. You guys we're showing you all this data, but you haven't really talked to your communities yet to see what your communities are interested in at this point. So we're trying to show you all sorts of different things that are possible to you, so that maybe when your community does say something, you kind of have an idea in your head that like, oh yeah, I went to this presentation and they showed us this information. There's all sorts of different types of information that we're going or not going over today. But in a broader sense, you have like estimates. So the Behavioral Risk Factor Surveillance System, BRFSS, which is Michelle's the coordinator for, calculates estimates. So, like you get a survey in the mail and the survey says, they'll call you on the phone and they'll say, like, do you smoke? It's a survey because it's not being asked to every single person in Texas because it's economically not feasible. So you have estimates. And estimates are good because they're cheap to do. You can do them in your local community too without much work. They can get progressively more and more complex, so you have to have special analysis. But estimates have problems in the sense that since they don't ask everyone a question, you might have gaps in your data. You have counts. Counts are going to ask every single person in your community. That's counts are on the top. You're going to ask every single person. So you can think of a count like a census. The census asks everyone in the United States, like your age and where you live. And so we have a definitive number of the number of people in the United States. But the census only happens once every 10 years because it's really expensive and really costly. Some of your communities are really, really small. So maybe if you're Loving County, which I don't think anyone is, but there's 61 people in the county, it wouldn't be too hard for you to knock on every single door. Whether or not everyone's going to answer or tell you if they're a smoker or if they've been sexually abused is like a whole different question. So you maybe have confidentiality issues there. Just actually, before I begin some of this, who lives in a community of more than 100,000 people? Or raise your hand. Okay, who lives in a community of less than like 10,000 people? So less than 50,000? Okay, so we have some smaller counties. Okay, good. Okay. So it doesn't sound like anyone's going to be able to knock on everyone's door in your neighborhoods. Other count, we have vital records. So every time anyone dies, we have a definitive count of every single death in the state of Texas. It's costly to maintain, and we actually have someone who's there, and they have a whole team that all year long they just do is they clean the data file and report stuff, and they're really good at it, but it takes a lot of work to maintain a count system. We have geospatial data, so Anne deals with geospatial data. So a lot of this, it's in some ways it's like a part of the data set. So we have deaths. With geospatial analysis, we can tell you like where the deaths occurred, and then we can do, you can do cluster analysis kind of stuff. Rates and ratios, we have, calculations of sorts, and then projections. Projections are really useful, and everyone wants to know how many doctors are going to be in the state of Texas in 20 years. They're also kind of like the hardest to come by in some ways because no one wants to be wrong. Okay, limitations of different data sources. I kind of went over this. Counts are costly. The rates, we have reporting requirements sometimes for rates. BRFSS can't report some things because there's not enough people answering the question, and they don't want to disclose it. Plus, the fewer people you have that actually answer a question, the more uncertainty you have about the data. Estimates, so you have sample size, and projections, you have uncertainty just because what's going to happen tomorrow might not be determined by what's going on right now. Okay. This is a particular problem we have in the state of Texas when it comes to, I'm going to go into how to get the data, but to understand how to get the data and where the data, like the issues where you can get some of the data, you have to understand that the population of Texas is not very evenly distributed throughout the state. you have 5 counties in the state of Texas that have more than 1 million residents. There's only like 25 million residents in the state of Texas. So 1/5 of the population of Texas is contained within 5 counties. There's 254 of them in the state of Texas. We have 39 counties with more than 100,000 people. The average county in Texas has about 100,000 people. It's just actually short. It's like 98,988 people. So 39 counties in Texas make more than the average. It's a very skewed distribution. And then you have 168 counties that have more than 10,000 residents. So you subtract out the 2, and the ones on the right-hand side are incredibly difficult to get data on. So most of you don't seem to be like you're from those counties, but you might be working with people who do. And those people are going to have a lot of problems getting data, just because there's not enough people. There's not enough people to do a lot of BRFSS analysis. There's not a lot of people just like to survey. And so it's not really a problem getting the county estimate sometimes, but everyone wants to know the number of women that are 168% of the federal poverty level that, that have all these different indicators. When you start drilling down, you're going to have nothing there. Okay, and in addition to this presentation, there's a handout I gave. Michelle's is very, very comprehensive, but there's some additional information there too. Okay, we're going to start with BRFSS, which is conducted inside the Center for Health Statistics, and Michelle is the guru on this, really, in the entire state, pretty much. I was going to show you how to get some smoking data and mental health data for people in your area. And, okay. So this is what the website looks like. Let me shrink this down a little bit. Okay. BRFSS is done, you can see some of this is, well, it's done every year. Not every question is asked on an annual basis. Yes, not every question is asked. But I asked for mental health. Mental health is, we have that data. And mental health, let me go to my notes, okay. It's actually right here. So if we want to know mental health, the way they operationalize it or define it, it's more than 5 days of poor mental health. And honestly, this is as easy as it gets. You just click on the indicator you want, you click on the year. Most people want the most recent. And you click submit query, and there you have, this is the number of people in Texas at risk, 20.1% of people at risk for poor mental health. And poor mental health is defined as having, down here, respondents 18 years and older who report they had 5 or more days of poor mental health, which includes stress, depression, and problems with emotions. So it might not be what you're defining mental health as. I'm not a mental health expert, and different organizations define it different ways. That's how BRFSS defines it. The data here, because I didn't select an area, shows Texas and the public health regions, and it shows some MSA data here. You can click on one of these MSAs, like here's the Austin Round Rock MSA, unless someone wants to pick some other area that they're interested in. I'm pretty open to clicking wherever you want me to, just in general. So you can see here, this is for the Austin Round Rock MSA. You can see the mental health for males and females. Yeah?
I'll give you an example that was driving me absolutely crazy. My name's Gary Tucker. I'm the accreditation coordinator for the Beaumont Public Health Department. Because I can find quite a bit of data at the MSA level, but they always throw us into Port Arthur. And the demographics of Port Arthur versus Beaumont are so different that it's just, the data has to be skewed. It has to be. There's no way it can be right.
I don't believe you're in here. I can look on the...
And we're not in general.
Okay.
Finding information on a city health department, unless you're El Paso, San Antonio, Dallas, or Houston, finding information on a city health department or finding data on a city health department is like finding the MC.
Yeah, you're going to have a problem just because of the size of the area. Oh, I'm sorry. Okay. It is possible, and Anna can talk about this later, you can call us up on the phone if it's not on the website, and you can say, hey, I want information on my local area. My MSA is always grouped in with this other MSA or other counties, and it's really messing up my data. Or we don't think that we're similar enough. And in that case, you can call up Michelle's group, and Michelle will do, what they'll do is they'll look at your area and they'll see how many people were sampled in your area. And if there's 50 or more people, they can start reporting numbers. So if you want the general number for like the number of people with poor mental health, they need 50 people. But if you want by sex, then you need to have really 100 people, because you need 50 males and 50 females. And if you want it by males and by economic status, then it goes on and on and on. So there is that ginormous caveat. What they can do is they can also start grouping years together, and Ann will talk about this. So there's ways of doing it with it. But I was just trying to show you that, like, we're talking about low-hanging fruit right now. We're talking about if you're at 5 o'clock on a Friday and something is due by 6 o'clock, where can you possibly get the information without calling us on the phone? Because we're probably not in the office at 5:30. Yeah.
I have two questions. Well, one comment and one question. The VRFSS is what is referred to as combined here. Bring together more surveys so the county health rankings does a little bit of that. Does a little bit of that for you. If we're talking about things that we can get for a 6 o'clock report, and we don't want to have to call Michelle to get the answers. That's what we've had to work. I'm from Williamson County, and we've done some work for Burnett County recently, and that is really our best source of information for Burnett County on an as-needed basis.
We're not a county health department.
Oh, you're city. Gotcha.
What they can do for cities is, because they have zip code level data, even though zip codes don't perfectly coincide with cities, is you can possibly aggregate zip codes to a certain extent. I'm not going to talk about zip codes today. That's a different conversation. I'm just not a fan of zip codes.
I'm sorry, I had a quick question too. When you say that Michelle's group can report, does that mean that we can talk with you about a specific data request, or what does that mean?
Oh yes, stuff that's not on the web. There's lots of things that they interview for that aren't necessarily on the web page. But there's also different areas. We can do special requests. You can email our group and say, hey, and it happens all the time. Especially it happens at the end of the semester by master's and PhD students, and I wonder why. We get requests all the time for special tabulations, and we can do them. It's not the biggest issue. It just takes a little bit of time. Okay, so and then I also on my slide is current smokers. So you can click this and click submit query. I'll get to your question. And you can see the number of at risk for current smokers. So you're probably, one of your health assessment people might be talking about smokers. These are all behavior issues. So obesity, eating healthy, all of this information on your regional level can be available on the website, and possibly for an MSA. And you had a question?
Yes. Mine was actually, I don't really know who is the proper person to ask this question.
Give me that for them.
But it's about timing.
Or in your pants pocket.
PHAB, they stress in several places that, these activities have to occur within the last 5 years. Well, what about that? Does that have to be from within the last 5 years also?
I can't answer what the organization wants for data. I mean, you're going to have a problem with some BRFSS stuff, though, is that sometimes you have to start, your area is so small, you have to aggregate so many years together that maybe it takes at least 5 years just to get enough.
Well, and a lot of the stuff, and I mean, even the stuff for the state of Texas, it's like they tend to have a 3-year lag time. And they've just now published the 2010 mortality rates and stuff. So it's already 3 years old almost, and it's really and as those of you who are involved in the process already know, this, to do this process is a multi-year process. I mean, it's a minimum of 3 years. I don't care what anyone tells you, you can't do this in under 3 years. You just can't do it. And so, and if you're starting out with data that's already 3 years old, and then it takes you 3 years to do this, it's like, well, is that going to be acceptable?
I can only tell you where to get the data. I can't make the decision process for you on which data sources to use. So I'm just going to go to the next one, but we can talk about it at a later time about different ways that you can approach some of these issues, and maybe Ann will talk about some of that. The cancer registry. You may not realize this. So there's cancer mortality, but the cancer registry works with I believe it's the University of Kentucky, and you can actually go to their webpage. And they have this mapping system. Well, it will give you data. So if you're looking at incidents, because mortality, we have cancer mortality data, but that doesn't tell you how many people have cancer at any given time. So they work, and they can give you this information. So if you're looking at cancer incidents, cancer site, for instance, if you wanted to look for breast cancer. Generally, we look at breast cancer in females, so you can select females, and you can click redraw, and it'll give you a map of the state of Texas by cancer rates, age-adjusted cancer rates, incidence of cancer. And if you scroll down here, you can actually find your county in Texas, and you can click, and let's see if there's any data for Nolan County. Yes, there is just a little bit of data for Nolan County, isn't there? But you can click View All, and you can see every county in the state of Texas in a confidence interval. Sometimes these confidence intervals are very large. Armstrong County, apparently, there was no data to be found for Armstrong County. And it's probably the way for some other counties, like Loving County might be a problem too. I'm scrolling down to Loving. Doesn't even show up in the system. That's how much of a problem it is. Okay, so you can find some cancer incidents. I mean, you can find pretty much most cancers. So if you wanted to go, you can look at colon cancer, colon and rectum cancer. I'm not a doctor. I don't know some of the terms. But they've taken the data. They put it in a nice little map. You can save the information. You can find the information. And if people are looking for cancer mortality or cancer incidents, you can use this tool to find it rather readily. The Texas State Data Center. The Texas State Data Center, if you're not familiar with it, produces basically the official numbers for Texas. The census actually produces the official numbers, but when you're talking about county population data, you're probably using their data. They also produce projections for the state of Texas for population, which is probably relevant to some of you guys. Their data is available. You have to click the data. And they have two things. They separate their data. Remember I said there's a difference between estimates and projections? They definitely make that distinction. So estimates are anything that happened in the past. So they don't produce estimates for now. Their 2011 estimates are going to be released in December. So they take all of the data for a year, then they do calculations on it, and then they release the estimate. So those are always after the fact. And they almost never change. Never change. Projections, though, are obviously using data from the past and then deciding what's going on in the future. This makes a big, big, big difference because I have gotten a phone call before from an individual who called me and asked why the population of El Paso dropped. Why were there less people now than there were last year in El Paso? And it's because there was projection, and we had projection data, and then when estimate data became available, we used estimate data. Well, the projection basically over-projected the number of people in El Paso. So the population went down when they switched from projections to estimates. But if you looked at the estimates over time, the population still went up. And this makes a big difference if you're trying your funding to your population. Do not do that with projections if you can avoid it. Because if the projections change and your population goes down, then your money goes down. Remember that, please. So I don't get a phone call saying about how the population of El Paso has gone down, when in reality it's always gone up. It makes, I mean, it's an uncomfortable conversation to have with someone. Okay, so population projections. They have this really cool tool. This is what I'm showing you. They last created the projections in 2008. So I clicked through to 2008. And then you have this popular projections tool set. I should tell you one thing. Also, they are going to update this in, quite honestly, maybe a week. They just released the data set to be tested to see if it makes sense, like last weekend. And usually it takes a couple weeks or a week for them to release the new set. So everything I'm showing today is going to be old in like a month. But that's okay, because the tool shouldn't change. With projections, you have multiple different migration scenarios. That's these things down here. No migration means that there's no one leaving or entering your county. The only way you have population change is with births and deaths. 1/2 migration scenario means you have half of migration from 1990s to 2000. That's a really high migration time. So you have the 1990 to 2000 migration, which is a really robust migration time. The half migration means it's not quite as robust. You kind of don't think things are going to go the same way they did during the decade. And then you have the 2000 to 2004, which is pre-Katrina. And then you have the 2000-2007, which includes Katrina. So generally speaking, the last two are used for short term, which means for the next 10 years. And then the half is for long term. And I'm going to show you the difference. We're only going to look at the 2040. And is there a county that someone is concerned about? I can pick them. Jefferson. Okay. And I'll show you the difference using the wrong, or using different projection scenarios we'll do. Show totals. Okay, execute. Okay, so this is the county and the state. If you look, the state of Texas population in 2040, if you use the no migration, is 26 million. Mind you, the census that just came out, the population currently is like 25 million. So that's not too likely. And then on the high end, it's 51 million. So there's a huge variation in the state of Texas population. If you use the wrong projection scenario, you will get a huge over projection. For Jefferson County then, it goes from 243,000 to 404,000. So a big difference. So you want to make sure you use the right projection scenario, and you can get that in the documentation file. And I swear there's nothing more entertaining than reading the projection scenario, like details. There's really nothing you can do about it. You have to read it though. They're going to change them in the next couple of weeks, so it should be way easier. The projections will no longer be based on migration scenarios from 12 years ago. So that is the projections. The estimates, if you want to get the estimates, you click on the data estimates and you click on online data tool. And lo and behold, you can get, for Jefferson County, it's the same almost tool for two of them. You click execute. And it is, the age range is 0 to 85. It goes up to a single year of age from 0 to 84. You can actually do a single year in here. 246,707. So that's the 2009 population. If you want the 2010 population for your city, it's a lot more problematic. So you have to go to Census 2010. And you scroll down. And you can go to the demographic profile summary file. Actually, here, let's do this one. Census File 1 data. Geographic profiles. Census File 1, 2, 3, those are different data products that the census releases, and they have different things. That's not necessary. You just need to know which one to go to. And then places. So a city is considered a place in the state of Texas, so you get places. So you're from which city? Beaumont. So letter B. And there's a lot of places, because it's not just cities. And I know I just passed it. Beaumont City. And it opens a PDF file. And it is not very big. And if I go to the next page, this is the layout. The population of Beaumont in 2010 census was, did I just come with the front? 118,296. Sounds all right? What did you say the city was that you are very much different from?
Port Arthur,
Port Arthur.
they're less than half
And I know that I am there.
that.
53,000. So you're right. They are about half that. Okay. So that's how you could use the Texas State Data Center website to find information. And if you notice, this is like a complete profile. So if you wanted to know everything about your county, this is all using the census data. So the census has stuff about age, race, number of people in households, like family stuff. So if you wanted to find out about all of that stuff for your profile, you can. I really, really like their projection thing though, because if you don't use the projection thing, you get a file that's 200 plus megabytes large, and you're going to need something much better than Excel to deal with it.
The Census Bureau's quick facts.
Yeah, I'm going to go, not in QuickFacts, but I'm going to show you how to use American Fact Finder, which is another way of doing it. Okay, so this is something that I actually created. It hasn't been updated too recently. It's waiting on one piece of data, but it's called Texas Health Currents. And the idea is that we we gather together a whole bunch of different data about an area. So is there a county that someone wants to know information about? Because I can, which one? Okay, Andrews County. Okay, demographic, mortality, natality, which is birth, health resources, communicable disease, socioeconomic, or complete report. What would you like to see about? Okay, this is everything. It's not the most complicated system, but because you just click on it, and then if you want one of the other ones, you just click on the words above, or you click change selection and you do it. What it automatically does is Andrews County, when you select Andrews County happens to be located in Public Health Region 9, so you can see the two comparisons there, or the three comparisons, but two other counties. And so the total population of Andrews County is 14,000. Which means it does not encompass most of Region 9. You can get population per square mile, marriage, divorce rate, census population. This is 2,000.
Is that the same thing they put on that fact sheet?
It's some of the same information. There is information in here that is not in there, though. For instance, some of these age groups are different. Foreign population, like where the people came from, is not in the fact sheet. Some of the mortality measures here are not in there. Live births, some of the acute care hospital, number of acute care hospitals and beds and licensed beds, staffed beds, not available in there. We're waiting on one piece of data, but I'm going to update this in the near future. Probably by the time you're going to be using this, it's going to get updated, but it's a pretty good general idea of what's going on in your area. Even if it's like the data is 2 years old, you can kind of get a good sense of what is going on. And then I have some health occupations, communicable diseases, so AIDS, rate, whooping cough, chlamydia, all those things. High school graduate attainment rates. Well, that's something that's not in the fact sheets. And then with and without health insurance. The other cool thing is that, for instance, okay, so this data here is from 2007. If you go to the health insurance sources and links to more detailed data, you can actually go to the website that got it, and that takes you there, and you can get the data. And that does it for every single indicator. If you just click on the box or the table below the indicator, you can get, so if you want to know poverty, total persons living without poverty, SAIPE. There you go. And 2010 is available. So I need to update my system. It's by, that's the other nice thing. Anything that you can aggregate a county to. So, whoops, let me go back to the actual system.
So if I took all the actual zip codes from, can you take more than one zip code? Like if I took all of the zip codes from Beaumont, would it give me Beaumont?
No. It's data sources that are primarily available at the county level. So it's county level data. So this system is like a dummy system. It's got a database that's pre-aggregated information, and it just displays pre-aggregated information. So if I can't aggregate it into the database in that way, I'm not going to put it in the system. Zip codes do not perfectly align with county boundaries. So they're kind of a problem to report county data when it's like they kind of overlap, if you've ever looked at maps of zip codes. And they always change too. So the zip codes are really problematic. But if you wanted to, when you asked about different areas, okay, so these are all the counties in Texas, and Texas is in here too. You can select. But then it's got public health regions, the 15 border area, the 32 border area. It's got the 43 border area, metro, non-metro, the health service regions, the Texas-Louisiana border, which is defined by the state legislature, and all the MSAs in Texas, and then the NCHS rural, urban rural RECA codes. So it's got large metro to non-core, which is micropolitan non-core or kind of more in the rural aspect. So these are the different areas that you can find information on. The area definitions for what is in an area is in this. So if you ever wanted to know like what counties are in an area, you could go to this system. If you also ever want to, I can send you, if you ever need like the data and you're going to go with this whole thing, I can send you the file that creates this system. It's just an Excel spreadsheet, it's a couple tabs in an Excel spreadsheet. It's really easy. But you can, as you can see, you can easily find information, kind of what's going on in your county. Okay, Texas health data. Much more, this is a dynamic system. This is not a dummy. That's not good. I hope I just didn't lose internet. Okay, good. SoupFin. So SoupFin, Texas Health Data, allows you to get information at a county level on births, deaths, the population in Texas. In 1 year, it's a little trauma data, but not really much. Or, sorry, trauma data, yes, but birth defects may be problematic. Okay, so we're only going to really concern ourselves with birth and death. So birth data. Oh, so you get this selection screen. The birth certificate changed, so they have two different selection pages. So you go, we probably went 2005, 2009. Okay, so if you want to go through it, you can see, you can select one or more years. You can actually add up all the years over time. When it comes to the mortality, it helps with calculating age-adjusted death rates and stuff, because you need to have so many deaths before you can calculate a rate. So you have this, you select whatever year you want. Then, for instance, let's say look at low birth weight. You just click the indicator. If you want another indicator, for instance, you want all births. So you have all births and low birth weight. You press Control, you click it. Is there a county someone wants to find information about?
Harris.
Which one?
Harris.
Let's go over here. Where? Harris. Oh, Harris. Harris is like all the information. Harris is like 4 million people. You don't need a local health department. You can have your own state health department located within Harris County. Okay, so you can do it by, you can report the data by age of mother. So I'm not doing that since I'm doing two indicators. I kind of want to have that as a row. So I'll do the indicators as a row. Actually, maybe I'll do, I'll just do year. I'll do multiple years here. And submit query. And there's the number of low birth weights for Harris County for 2007, 2008, and 2009. So incredibly useful if it's 5 o'clock. Even though, by the way, 2010 data is available, it's just not in the system right now. So when the system gets updated, I mean, it will be available. So, okay, so that's birth. Death data. Death tables, 1999 to 2009. Is there any death indicator that anyone wants to look at? I put cancer in my thing, but some people are more interested in other things. TB? TB. Okay, let's see if I can find TB. Oh, was it? Okay, good. Even though I use the system, I don't know all of the. Mortality is one thing. Okay, is there a county someone want to know TB about rates and death rates? These are death rates, not incidents. Victoria. Okay. Let's do multiple years because I don't know how many deaths you have. Race. We'll look at all. But we'll do it by race, ethnicity, and then we'll do it the day by year. And we can calculate age adjusted, so we want frequencies and rates.
Yeah, South Texas.
Okay, so
Is there an age adjusted for the 2010 added in there yet?
Eight-
I thought it was 2000.
it's because, no, well, if you look, they've only done 3 populations here. So it takes them a very, very, very long time to change the population. Because really what you're saying is that fundamentally the population is different. So like age structure wise. So because the age structure in the United States hasn't changed that much in 10 years, no one's touching the age adjusted standard. I mean, and it makes a big difference because now I believe it's weighted heavier towards the older categories. So if you have deaths in older versus younger categories, it means that you have different age-adjusted death rates. I know a little bit about that, but I forget exactly what's going on. Okay, so obviously that didn't work. We got 0 deaths.
Webb.
What? But someone with the valley.
Webb.
Webb County. Okay. Hey, that's my county. My name is Chris Webb. Oh, okay. So as you can see, not many people die from TB. Which one?
Infectious disease.
Infectious disease. Well, look, I know that it's. I think you have to select multiple. You can select multiple. For instance, I can do salmonella, and you're gonna have to help me with infectious diseases here. Viral hepatitis, I guess. I don't know. HIV. You could select a whole bunch of them, and then hit submit query. Oh no, I'm doing something. Influenza's in here. I believe it's pneumonia and influenza are grouped together, but the system allows you to drill down so you can separate. Am I passing? Oh, here it is. Okay. Let's see. So if I click influenza and pneumonia, then I can click down to influenza, and I can look into influenza deaths. So the system allows you to drill down. For instance, here is a better example. If I click cancer, it's malignant neoplasms. Now let's do Texas so we don't have to worry about, all those things. Okay, so here's Texas, the cancer mortality rates. There's a slight difference between Texas, the cancer registry, and they have slightly different cancer rates. Yeah, it's different reporting systems. But you can click on neoplasms, and then you get this, and you can drill down to neoplasms of the malignant neoplasms. Okay, so that's the death. That's Texas Health Data death thing.
Did he group it by age, because one of the pneumonia deaths, that would be directly linked to the preventable hospitalizations with pneumonia and frequency and older cough. So I was just wondering, can you divide that by?
Yeah, maybe I should have just kept cancer. Yeah, there's cancer. Okay, so you can, if you see here, row, you do age group. There. Now you can obviously see that cancer deaths increase with age. So you can do that with any indicator. Obviously, oh no. I lost my spot. I'm here, I was just here. Okay, so now the next part before I explain how to use the census website, I had to explain a little bit about American Community Survey. It's a survey, so they interview people across the United States, but for most of Texas, there isn't enough people in any given area to they get enough respondents so they can actually report the data. So what they do is they just carte blanche, like BRFSS can do it individually, so they say like what question it is and what county. The census does not worry about like individual counties. They just say if you're less than 20,000 residents, your data only exists as 5-year averages. If you're less than 65,000, you have 3-year averages and you have 5-year averages. And if you're above that, you have 1, 3, or 5-year average data. It doesn't mean, for a 5-year average, doesn't mean that you can just say that the estimate is for the middle year in the 5 years. It's actually all 5 years averaged together. It's a big misunderstanding, but and when you're using this data, you want to use like and like. So don't like in one sentence maybe report a 1-year estimate and then the next sentence report like a 5-year estimate and then compare them, because you're comparing two different data sets. So I just wanted to say that, so data availability, as you can see in this chart, most of Texas is only available in 5-year averages. It's a huge data availability problem that is derived from our population in Texas. And mostly metropolitan areas have 1-year averages. Yeah?
Is there a way to adjust that for population mobility? It's going to change from 1 year to the next.
No, it doesn't. No county in Texas is so close to the cusp that it changes them. The only time I've seen it happen where you switch from one to another is actually in Louisiana, where so many people had, after Katrina, there was so much population loss that counties suddenly dropped down into a lower level. But there's not enough mobility to really change these things in the short term. And I mean, I would have to make a good number of phone calls to the census to see if they're actually thinking about doing that. It is possible, though, to have a county have a 3-year period 1 year, and then the next year they'd be in a 1-year period if they bumped up in population so much. But I just looked at the population in Texas, and there's no county that's like off by 1 or 2 people. I don't know. It's theoretically possible, but realistically, I don't think it's going to. No, there's tons of mobility in the state. I don't have that chart up, but all these people in West Texas, a lot of them are moving into the metro areas. So we have population increase in like Travis County, Williamson County, in Hayes County. I mean, I actually live in Pflugerville, Texas, which is the 7th most rapidly growing city in the United States, according to the census 2010. West Texas has population decline. So you have all these people in the rural areas moving into the urban areas, and there's not enough retiring people moving back into the rural areas to make up for that. But no, there's huge mobility in the state of Texas, but I don't think the census isn't just doing it that way. I think you kind of have to be above a threshold for a certain amount of time, and no county is like right at the threshold. Because I get that question every once in a while. Okay, American Fact Finder. I will show you how to use this, and this is the most complicated system of the day. 216. Okay. Okay, this is American Fact Finder. It is by far it is definitely the most complicated, but it's also a huge source of really rich information. And I am so happy I get to do this visually because I've done this over the phone and it's way too long. The way you use American Fact Finder is you have to go back to that map and you have to think about where you're looking for information on. Is it a really small county or is it a really big county? Because it impacts your data availability. So the easiest way to do this is to click Topics. Okay, and down on Topics is Dataset. Down here you see ACS, they just released this like weeks ago or a week ago or something. 2011 1-year estimates. But then for the most part, let's look at 2010. We have 5-year averages, 5-year estimates, 3-year estimates, and 1-year estimates. So if you're in a small county, don't even try to click the 1-year estimates. It's not going to work for you. If you actually click the 1-year estimates and then try to click on your county, it's kind of basically going to give you nothing. You can click your county and then try to click the estimates later, but it kind of gets confused sometimes and tries to give you the United States information. That's not going to help you. Is there any county in Texas that someone wants to look at and they kind of know the population of the area? Because I can pull that one up. So that's a big county.
You don't want a big county?
No, it's okay. So Denton County has 5, 3, and 1-year estimates because it's over 65,000 population. So you can use any of these 3. I'll click the 5-year estimates. Okay, so we're going to look at, I wanted to look at some things. Population 65 years and over with vision difficulty. So that, I've already collected the data set. Let me go to the geography. We want Denton County, so those are counties. You can get places within the state. Places are cities. So if you want a city, that's a place. But we want Denton County, so there.
We're actually there, but my eyes are so bad I can't tell.
Okay, let me start over.
From there.
I'll start over here. Okay, so topics. Click on the left side topics. And then the bottom option there is data set. You click on data set. And then there's 2010 ACS 5-year estimates. That's what I clicked. And by the way, this little number next to it means how many different data tables are available. Okay, so I'm going to close that little sub window here. Then I'm going to click on geographies. I could have done it a different way, but this is the way I'm going to do it. Geographies. And it says select a geographic type, click county. Then select state. So you want Texas. This will only give you the counties for which data is available at your geographic level. So if I picked 1-year estimates, it would only give me counties with more than 65,000 residents. Denton County is one of those counties. So Denton County, I select Denton County. I click add to your selections. And every time I do a selection, it shows up in this up here. Okay. As far as when I want vision, it's in the disability. So I go back to the whole topics tab, and I click on people. And I get a whole bunch of different indicators. So this is where the ACS is amazing, because this is all the socioeconomic indicators that you want for you're probably going to have in your assessment. So some of these have multiple different data sources. For instance, marital and fertility status. You can get a marriage rate from this, or you can go to the vital stats records from DSHS, and you can get the actual number of people who married. This is an estimate. This is a survey. I wouldn't use a survey data to find out how many people got married when I have a count data available and know the exact number. Okay, so disability. Click disability. And there's one disability table. Did I do something wrong here? I click something wrong here. Because it's only showing the United States. So let me click something here. Let me click county, Texas, Harris County. Oh, let's click Denton County. Click data set. I'm going to click 1-year estimates. People, disability. There we go. It didn't want to give it onto the 5-year estimates. It only wanted to have it on the 1-year estimates. Oh, that's right, because they changed the definition of disability. They changed the definition of disability. I clicked disability, by the way, and then I got all these options. Table S118, disability characteristics. If you, these are all the tables that are available. There's a bunch of them. You can change the number of them that are on the page. Just 75 up here. If you don't know what it's in a table, you can click this little eye on the right-hand side, and it won't give you the data, but it'll give you what's available, like what the table looks like. And I can see that this table has, if I want the population 65 and over with a vision difficulty, that is in this table. So I go here, I just click that, and Denton County is there. I can see it's Denton County. So Denton County, percent of the population with a vision difficulty, 5.4%. The estimate, 2,467, give or take 757 people. As you can see, it's by age. You can also see that they only do, for under 5, they only do hearing and vision. Then they have cognitive disability. Most of the disability characteristics in the census are regarding work. So because the census only asks things which there's an economic necessity to of sorts. So someone's asking them about work disability. So that's what's, can you get to work? Can you go to the hospital? Can you see? Can you read? Okay. Is there an indicator that someone else wanted to know about? I had another one. I've been asked that in the past, like housing. Can you tell me how old your houses are? Because people are concerned about lead poisoning in houses. That's also in here. So if I wanted to know about like housing, I take the disability tab off there, hit topics. I take it's under housing. It's not a people, it's a housing characteristic. You can see year structure was built. I can click year structure was built. If I actually select the 5-year averages, I can get every single county in the state of Texas, and I can show you how old houses are for every single county in the state of Texas. I know it's a year structure built. And I can see that we have X number of houses built before 1960 in a certain area. This is 1-year estimates, so this is like only big counties, but you can get this for 5-year. I know that for a fact because I did it earlier today. Does anyone have any like socioeconomic question that you're wondering about your little area where you're from?
Do you happen to determine if there was a lot of high lead in our area since it was the age of the housing?
If you looked at the age of the housing, and you can get some of this information, much lower level. Like if you saw there's 5-year averages or estimates are available for tract, you might have data suppression issues, but in theory, if there's enough houses that got sampled and people responded, you could get some estimates at the tract level about houses. Your confidence intervals will probably be fairly large. Yeah. Yeah. Okay. And then one other thing I wanted to show you. I get this question every once in a while because it involves your ability to disseminate data. But let's pick out percentage of people in your county that no one in the household speaks English very well. And I worked on a project once where we needed this information because they wanted to look at Spanish-speaking households, so they needed to know how many, they were targeting Spanish-speaking households and like Asian households, like Filipino households. They needed to know where these people live so they can then send them literature. So in order to find that out, they used American Community Survey data. So that is under language. Language spoken at home. It also could be English usage depending on what you're looking for. Geography, I already picked the 5-year estimate, so we'll do every county in Texas. County. All counties within Texas. Taking a little bit of time. Okay, I want 1602. Yeah, no one age 14 and over speaks English only or speaks English very well. So here you can look at a table, and so you can see, and here you can see all counties in Texas. It's the way you can download the data, so you don't have to like scroll through left, right. But you can see here, in Andrews County, 10.7% of households, no one over age 14 speaks English only or speaks English very well. It's not the most shocking of characteristics to know that most of those people speak Spanish. Although, this is actually very intriguing to me. I've never seen this before. 61.3 Asian and Pacific Island languages. I'm very intrigued by that. Most of the time it's Spanish. But if you were, for instance, trying to do an outreach community thing and you have all your documentation in English and you're not getting any responses, it could be because no one in the households that you're trying to reach can read your documentation. It also then maybe impacts, your community is better than I ever will. So you can do radio ad, like multiple language radio ads or multiple language mailers or newspaper ads, things of that nature. And the way you can then back it up, because you're gonna maybe ask for money for a grant or something, and they're gonna say, well, why do you need to do it in Spanish? And you can say, because I went to the census, and the census says that 30% of my households, speak Spanish at home or something like that. And that's all in the language, which is very useful. In the presentation, there's a link to a document, and we can put the document in here. But it's a handout of sorts, so it's a couple different pages. It's not as comprehensive as what Michelle showed you earlier with like the 15 indicators and whatnot, but these are some different query systems that can be of use to you, depending on what your stakeholders think are useful. So something that I didn't go over earlier is under chronic disease, and it's a YRBS. The BRFSS, which we've talked a lot about, is a survey for adults. And it's local area, but here it goes. It does not survey children. And so the survey that we get for children is called YRBS, Youth Risk Behavior Surveillance System. There's one humongous caveat with this system. Whereas BFSS can possibly give you local health area or data, YRBS has none of that. It's state only. But if you're interested in finding bullying information or other issues which there's not much information to be had, this is really the best source that you have for it. It's conducted every 2 years. It asks a lot of pertinent questions. It doesn't ask some questions, like sexual orientation of teenagers. It doesn't ask some of those questions. But it does ask about sexual violence, things of that nature. The data it's a random sample of a couple schools, not hospitals, schools. We ourselves do not know which schools were surveyed in Texas. That's done at the national level, and then we get de-identified information. But this is conducted within it's run by a person inside the Center for Health Statistics, and actually on Michelle's team. So for instance, if you want to know about sexual behavior of teens, so first sexual intercourse, or let's see, use some form of birth control. You're available, 2011, submit query. You selected the question, submit query, yes. Here you can see the total number of students who had sexual intercourse during the past 3 months, the percentage who used Depo-Provera or birth control pills to prevent pregnancy, 15% of all students, and you can see a couple breakdowns. This is not available at the local level. So whether or not it's going to be useful to you, specifically when you're figuring out your health assessment, is up to you and your organization. But this is the best information you can get on some of these questions. There are a lot of questions that people have, or these are hot topic conversations. For instance, I know violence-related behaviors, felt unsafe at school, carried a gun, physically fighting, dating violence. Oops, I don't want 2011. And you can see hit, slapped, or physically hurt on purpose by their boyfriend or girlfriend during the past 12 months. This is really, really uncomfortable stuff if you are a parent of a teenage girl. I'm sorry if you're going to call your child up and say like, oh my God. And I can't get to the website because I'm an idiot. I hide it. I try to hide it. The one I like is sexual behavior, though, and not like it, but I mean, it's 4 or more partners in their lifetime. This is not fun stuff. I'm sorry if you just had a cookie and now you're bummed. So these are high school students, and if you look at 16 and 17-year-old, almost 20% of 16 or 17-year-old students in this survey say they've had sexual intercourse with 4 or more people during their lifetime. So even if it's not useful for you for your assessment, it might be useful for you in another sense. And this is the YRBS. You can request information from our CHS to get more information on this, but you're not going to get it for your local area. It doesn't exist. It's conducted once every 2 years, so that's another issue. But as you can see, it's 2011 data, so it's very current. Okay.
I just want to add a couple other school surveys that are out there. I don't know whether or not you can get geographic data on them or not. There is the Youth Tobacco Survey, which is focused on tobacco and the practices and attitudes towards tobacco. Again, I don't know how well defined the geographic areas are on that survey. And then there's also the School Health Survey, which is a substance abuse survey, again focused on substance abuse, and but it does not cover violence and being bullied and other things that the YRBS does.
Yeah. Percentage of students who have ever been physically forced to have sexual intercourse when they did not want to.
And those two surveys don't have query systems or anything of the sort. So you'd have to approach those programs directly, and I have those contact information.
Okay. So that's a bummer. I was going to show you, so not all of our information is within query systems. Some of it is in just general reports. The vital statistics reports, which are under CHS reports, you can get information. Here's the 2010 data. So in the query system, 2009 was the latest. In the reports, 2010, the latest. I wasn't going to go too much into that. It's a lot of, here, let me just show you. There's a lot of tables. And it's just a lot of information you can go into. But you wanted to mention something?
Yeah, I want to mention something here, and I actually had this thought earlier when Chris was talking. You know, these are pre-created tables, but I think Chris and probably Michelle mentioned that, you know, this is all based on individual data, and this is something that could address, you know, if there's not data specific to your area, like the man who's in Jefferson County, you know, the difference between Beaumont and Port Arthur. It's actually possible to aggregate this data to areas that it's not initially aggregated to. And I've worked with the vital statistics people, for instance, to aggregate this data to school districts, for example. Or you can do it to zip code areas or something of that nature. And you do that based on individual data. That's not reported back to you, right? It's cleaned. You're not going to see anybody's identifying information. But just as long as there are enough cases or enough births or enough whatever it is, that can be generalized to some other area. We do that all the time, even if it's not initially available at that level. So that's something to keep in mind, like when you look at a lot of this data or some of the data that's collected, you know, by person, birth, or death, or something of that nature, is that it is possible to get it to a more specific area than you might find on a website.
For instance, like teen birth. If you want to know the number of teens that had this is all data is pretty much aggregated for the most part to county level. It's kind of the general reporting level. But if you wanted to find teen birth for your city, you could contact the vital statistics people, and city is actually one of the is in the birth record, so it's very, very easy. They don't even have to go and contact Ann to do, you know, a request. The only major data source I can think of that is not available like that is abortion data, which is not going to be available at, like, it's going to be at county level, but not at city or anything else, because it's not even collected at those levels. I was going to show you the infant mortality rate calculator, which is available on the left-hand side over here. So we see infant mortality rates. It's something that an individual in CHS developed, and it's the infant mortality analyzer. And there we go. It's dynamic. It does it on the fly. It's written in Java. So, for instance, you can select multiple years, 2005 to 2010, for all races. Let's see. And you can find the number of infant deaths. This would be Texas, geographic area Texas. And so it just calculates it all rather quickly. Oops. Now, if you want your county, is there a county that someone wants? Tarrant? Okay. Tarrant County. We want multiple years. I can do 2001 to 2010. Oh, just 10. 2010, infant deaths 209, live births 27,000, so 7.5. Is that per 1,000 live births? So it's something that you can do for any county in the state of Texas, and you can see a graphical trend. I mean, because if you do multiple years, you get a trend line, which may or may not, not everything trends. There. Looks relatively stable for Tarrant County. And that's the infant mortality rate. And all these are, it's hidden of sorts on our website. It's not, out there per se. It's like some of the other things. So you have to go to the vital statistics web pages to get those. And it's the infant mortality rate system. And then, of course, there's the tables here. So pretty much everything here can be found can be done to your local level below a county if you send a request in. Okay, do another one. This one, I'm not a Medicaid aficionado, but in the document is HHSC publishes Texas Medicaid enrollment statistics. So you can get some Medicaid information. Let's do October 2012 does not exist. January 2012. Page cannot be found. And I am having problems right now.
Chris, you have a question?
Oh, yes. I didn't see a question. Yes.
The question was that can we get the infant mortality rate by cause?
I don't see why not. Infant mortality is generally calculated by the population under 1 year of age, mortality under 1 year's age. So you just take the number of deaths for population under 1 and then divide it by its total number of live births. You could, because it's just it's the death file, you could look at underlying cause of death. So you're going to see things like SIDS.
Yeah.
Like what the website meant to show that
Yeah, that was just the general infant mortality rate. But with any of our data, I just did a presentation a week and a half on this. There's 60,000 plus different mortality codes. And in Texas, we have like 2,000 plus different causes of death listed in the mortality database for 2010. So we have 2,000 different causes of death. We're not listing all of those causes of death in our reports because there's 200,000 plus deaths in Texas a given year. So you kind of pick and choose what are the bigger causes of deaths, or there's a standard report that they use there's different kinds of reports, but there's standards. So for infant mortality, generally just report the total, but like SIDS or drowning, these kinds of things, we can get that. You just have to contact the vital statistics people. For that matter, actually, if you use Texas Health data, the system I showed you earlier, if you select the age and then select, I think I can show you that. This is this Texas Health data. This is our CHS webpage. It's right at the first link. If I look at death tables, and I select age group, I do under 1, and then okay, so my column is year, my age group is under 1, my causes, and then I select Texas. I'm selecting all. I haven't done this before, but I think this should work. And then I'm not going to calculate rates. There we go. That's the number of deaths. That's deaths per cause for the population under 1 year of age. So septicemia, diseases of the heart, influenza and pneumonia, which is probably all just influenza. No, actually, it's not. And nephritis, Certain conditions originating in the perinatal period, not too shocking, and congenital malformations, and all other diseases. All other diseases in general tends to be a lot of deaths. But is that what you're looking for? Okay.
Any of those that look like a link, you can drill down. So if you were interested in a particular kind of heart disease even, you could break it down to that. You know, I did something similar with a study looking at kind of a healthy, San Antonio and Austin, trying to institute these healthy programs, and then we compared that with different types of heart disease, so not all types of that general ICD code. And so it's possible to actually pull out something that targets what you are really interested in.
So cardiomyopathy, 14, I think of the 45 different deaths from disease of the heart. So that's how you can use the system to get you some of that data. And then going back, I was trying to do the Medicaid, but it was giving me a problem before. I am not able to use it today, am I? Oh, I got something. Okay, so this gives you Medicaid enrollment by county for September 2009. So you can scroll down to your county and you click at total enrollment, children's Medicaid, disabled and blind. These are different. I am not an expert in Medicaid. I do not pretend to be an expert, but sometimes I know where to look. And I know to look on this page. I also know that the group doesn't have the best web presence. So I would call them on the phone if you want more Medicaid information. But this website, it's on the link, will give you some Medicaid information. It's so this link right here. And I'm really annoyed that I can't get this. It says it's there it's okay, whatever. Here's Medicaid. This is just the state of Texas, though. It gives you the state of Texas Medicaid by month. I wanted the local county information, but oh well. Okay, SNAP and TANF. We can also give you some of this. This better work. SNAP and TANF, temporary assistance for needy families, and SNAP is nutrition. Yeah, I can't remember everything. I try. So okay, you can see SNAP cases and recipients. I just clicked a year, clicked a month. Unfortunately, this isn't available for, in an easy to use way, but clicking enough and you get SNAP food benefits. So for some of the areas, if you look at the number of children and then you look at the number of people that are on foods, TANF or SNAP, it's a huge percentage of the population in some areas. And it's probably a good indicator for the economic conditions in your local area. So food stamps. And kids count. Has anyone ever used this website? Okay. This is, it's Kids Count is an amazing website that seems to get a ton of information. Sometimes it's not always the most up to date as it could be. But you can click data by state. We can scroll down to Texas. Okay. View community level. Okay, so is there any community that anyone wants to look at? A small area, county? I'm asking you because it might be relevant or interesting, huh? Andrews? Okay. So you can see here the total child population is used 2010 census data. Children enrolled in Medicaid, 31.6% of the state of Texas. Children are enrolled in Medicaid. Attrition in public high schools, 27.0%. That is really high. It seems high. I don't know what the rest of the country is like. View community level profiles. So I want county. And you said Andrews. Here we have some indicators that the Kids Count website has decided are, worthy to put on their website. So children's poverty, children's unemployment, children's Medicaid, SNAP, births to women receiving late or prenatal or no prenatal care. A lot of this information you can actually get from our website. Like the prenatal care, you can get from us. Medicaid, I just showed you where you can get Medicaid. Unemployment, you can get, I have a link on there, you can get it from from a couple different sources. The local LAU, which is the local unemployment area data. Births to teens, public school enrollment. So this is all information that's totally free and is available on this website. So if you're looking at health indicators, and like you can pay someone $200 an hour to get this information for you, or you can do it for free, for your time. It's not free, it still costs you time, but it's not $200 an hour. So this Kids Count website is available. And then I wanted to show you a couple of different things that are not on the CHS website. Let me go to one of these over here. Okay. Someone asked about these earlier, and there's I'm in charge of the Health Currents, which is the query system I showed you to you earlier, but we have what they call Texas Health Facts Profiles. And what they are is they're printable PDFs that you can take and you can say like, oh, this is the condition of my county for the most part. And so they're available we have them not on this website, but we have them back for over 10 years. So you can over time look at how things have changed in your county. And a lot of times the state legislators will use these and take them and then, like go into a thing and kind of see what the population is like, how many people have tuberculosis, things of that nature. So let's just pick a county that I don't hear very much of, Jim Wells County. And, okay, come on. There we go. Here's what it looks like. And I do not see there's usually a toolbar at the top of my page, to zoom in. Here we go. So, you can go and you got a little map of Texas. You can see where the county is. You can see the demographic breakdown. 77.9% of the population is Hispanic in the year 2009. This does not include the census 2010. It's pre-census 2010. These are estimates from the State Data Center. When we talked about estimates, these are estimates. These won't change. The breakdown by age. We have TANF, unemployment rate, per capita personal income. So is this really relevant? Do you care about the unemployment rate in 2009? Probably not so much. But you can look at the whole state or the whole county as it's a snapshot in time, right? You can see what it was doing at that time. And if you actually pull the sheets up for multiple years, you can see how the unemployment rate's done over time. We have all this data in an Excel spreadsheet. So if instead of going and trying to copy and paste from a PDF, if you ever want, you just call us on the phone and we'll give you the spreadsheet. Actually the spreadsheet's on the website too. But if you want older stuff, you need to call us. So communicable diseases, natality, mortality. Some of the same stuff that's built out in the health currents that I made is from this. It's because this was created first and then health currents was created later and we shared the data. Just like health currents though, here's all the counties in Texas, MSAs, regions, border definitions, metro, non-metro, and CHS regions. So if you ever wonder what the map is there a map of this one? I don't pull this one up that much. These will be maps, the MSAs will be maps of the MSA. Oh, here we go. So these are all the micropolitan counties in Texas. Nice little map. Micropolitan is like tiny metro. Okay, there's that one. We have another website inside of DSHS. We collect information on every inpatient hospital encounter. So every time you get admitted to the hospital, that data goes into a collection and we store it. It's an incredibly big file, it's incredibly useful, and it is humongous. So if you don't have experience dealing with big data, you might have a problem. But they do some things on their website. And I might have, Oh, here we go. Healthcare Consumer Information, THCIC. So they'll do indicators of inpatient care. So for instance, if you've maybe had an operation that went bad, or like you had an operation but they left a sponge in you or something like this. Never events. Those kinds of things might be indicated in their thing. So they're really, really regulated by the state legislature and what they can and cannot report. We cannot link to their data. Like they have information on hospitals, inpatient information, like when you went in to give birth, but we can't link the vital record to that patient stay to see how much that birth cost. Like they can actually report that separately, but we can't do linking to see even if the one system says one thing and another system says another.
Actually, Chris, that was kind of overruled in the last legislative
It was overruled,
session.
but like for instance, you still don't have access. Like I can't link the Health Professions Resource Center data, which includes all information on all physicians in the state of Texas, to the THCIC data that says which doctors gave which procedure. Like for instance, if I wanted to link, see what doctors gave, did cesareans versus induction of labor or whatever, I can't link the two data sets together. There's like really strong rules about what's displayed in those.
And there's a lengthy IRB process in all of it too.
They have to de-identify. The indicators of inpatient care in Texas hospitals 2010, you can search by hospitals. So we'll just click that. You can see pancreatic, don't ask me to read these things. Coronary artery bypass graft. And you can click that and you can get it for your MSA. You can get it by individual hospitals in your MSA. So we'll just do, this is actually useful because you can see the number of procedures. So for instance, I guess if in theory, this doesn't necessarily help your process too much. I mean, these people report a lot of data. But if you were going to have an operation and you wanted to see which hospitals perform it more often than others because you were trying to choose which hospital to do it at, you could go to their system and you can see that, Abilene Regional Medical Center did 116 times in 2009, and Hendrick did it 140. It's up to you to decide what's important or not. Anyways, they collect a lot of information and they report some of it. You can also buy their data. It's under, let me go back to DSHS's website. They used to be their own little agency back in the day, so they're kind of separate from the rest of our entity. Under CHS activities, it's healthcare consumer information.
It used to be a council, its own governor appointed council, but the legislature expanded that. Now it's just a collection.
That they do. It's them. And they also do statistical reports. So childhood obesity. This is just an example. This would mostly be, some of it's local area and some of it's state. It's such a huge, because this is hospital discharge data. So these are all basically it's not every hospital in Texas, but it's almost every hospital in Texas. There's reporting requirements, like if you're in a small area size and all these different things, which might affect some of you in this room. They don't have to report. It's kind of a burden thing, but you can see. Yeah, there's exempted hospitals. Race, ethnicity of children with a discharge diagnosis of obesity. So you can see how many people were discharged from a hospital for this indication. So they have a lot of information. It can be a mountain to pile through. You can contact them and they can talk to you. They will not do data analysis for you though. They will sell you the data, but they will not do analysis for you. The data set costs a lot. It's also very big. If you were like a college professor and you do research for they will work with you, I think, and as long as you kind of cite them and do some other stuff, they can kind of like either I get it discounted or free or something. I'm not totally familiar with how the pricing works for that, but I know that they've worked with people in the past.
Well, you do have to go through the IRB.
And then one last group I was going to talk about. And every hospital does not have to do patient discharge, but every hospital in the state of Texas, except for military hospitals, has to, state licensed hospitals, has to do an annual survey. And by survey in quotes, I mean that realistically, it's a count because it's every single hospital in Texas. So that's the Center for Health Statistics Hospital Data and Collection and Reporting System. On the left side of the CHS webpage, it is, whoops, I hit the wrong one. It's in there too, but hospital survey reporting. Okay, these are, their website functions for two reasons. One, to help hospitals get the reporting done, and the second, to report the data. So like a lot of these links on the left side are actually more for hospitals. But they do have, on the bottom here, current Texas hospital reports. So you click that, you can see, and the last one's 2011 is less. They're collecting the data right now for 2012. But you can see in here utilization reports. You can also see fact sheets, but I'll do a utilization reports and charity care. In the utilization reports, which this one's 2010, you can see for every county for which there's a hospital in Texas, the number of beds, staffed, admissions, inpatient day, Medicaid input, length of stay, staffed occupancy rate, different utility measures of hospitals. Services they provide, yeah. They also collect information on, like, they'll say like how many beds, beds devoted to everything. Every time they have a bed and they have a specific purpose for it, they report that. They also give the number of inpatient. I mean, I worked for them. I did this stuff for a year. I'm trying to think. It's 40 pages long, and hospitals have to do it every year. So how much Medicaid they spent or they got, how much charity care they did. All of the things that happen for every single every single hospital in the state of Texas, these guys have. And you can request it just like any other data source. Their data set, they also sell their data set, but you can ask them for a couple questions. And I think
much more reasonably priced.
it's much cheaper than THCIC. Plus there's only 500 something hospitals in Texas. So their data source is open, and you can open it in Excel. I mean,
Yeah, you ready to go?
Where did you want to? Oh, the presentation.
Okay, so